Good evening, everyone, and welcome to the International Veterinary Conference on Evidence-Based Medicines. I am a barrister, Uzma Manullah Khan, the Deputy Director of Legal Affairs and Compliance Division of MAGU. I am the Director General of the Operational Excellence and Efficiency Division of MAGU. Dr. Myra will be your host for this online conference. I am thrilled to see so many dedicated professionals in the veterinary fields gather here today. On the behalf of the MAGU, I would like to express our sincere gratitude to all our esteemed speakers and international attendees for joining us today. Before we begin, I would like to acknowledge the hard work and dedications of our conference head who organized the conference on an international level, Dr. Ijaz Rashid. So I will introduce Dr. Ijaz Rashid. It is our esteemed honor to introduce Dr. Ijaz Rashid, a visionary leader and a renowned veterinarian. Dr. Ijaz Rashid served as the Noble Journal Royal Imperial Command of MAGU, Chief Secretary General of MAGU and all divisions, and head of supervisor of this International Veterinary Conference. He's also the CEO of East Windsor Animal Hospital in New Jersey, USA, and has previously held position as the CEO, Cream Ridge Pet Care Center, and Chief of Staff as the Minefield Pet Hospital. Dr. Ijaz Rashid has completed postgraduate clinical studies at the University of Missouri, Columbia, USA, and is certified in a wet stem cell therapy. He has achieved groundbreaking milestones, including introducing the anti-cancer vaccine in collaboration with Germany and a successful breeding the Royal Bengal tiger in zoo captivity at Bahawalpur Zoo in Pakistan, the first in Asian history. So thank you so much, Dr. Ijaz Rashid, for providing us such an amazing platform, and your contribution have made this event possible. And we are grateful for your support, and we are heartfelt thankful to our all speakers who manage their busy schedules and take time for us. We welcome all of you, Professor Dr. Anila Durrani, Professor Dr. Muhammad Yunus, Dr. Humaira Ahmed Khan, and Dr. Rashid Aziz. Now we would like to invite Dr. Hafiz Muhammad Shaki for recitation of Holy Quran. Hafiz?
Assalamu alaikum. Please confirm, am I audible?
Yes.
Yes, you are audible.
Okay. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الرحمن علم القرآن خلق الإنسان علمه البيان. الشمس والقمر بحسبان والنجم والشجر يسجدان والسماء رفعها ووضع الميزان ألا تطغوا في الميزان وأقيموا الوزن بالقسط ولا تخسروا الميزان والأرض وضعها للأنام صدق الله العظيم.
جزاك الله.
Jazakallah.
Thank you so much, Dr. Hafiz. Here we would like to invite Miss Haya. Miss Haya Farhaj, Advisor to Special Deputy to Chief Commanding and Controlling General of MAGU. Miss Haya will give you a brief introduction of MAGU.
Miss Haya Farhaj, if you are here, please raise your hand.
Miss Haya?
I think she is not here, so we have to shift this section in the end of this conference, right? Please move on. Barrister Uzma Amarullah Khan.
Now I know invite our esteemed chief guest, Professor Dr. Muhammad Yunus, a Vice Chancellor of UES Lahore, Pakistan, for the opening ceremony and a brief overview of the conference. Materials Professor Dr. Muhammad Yunus, a Vice Chancellor of UES, a postdoctorate from University of Minnesota, USA, and University of Veterinary and Animal Science, Lahore, Pakistan. Won at least a 6th Academic Merit Scholarship, Star Award 2009 by South Asian Publication and Excellence Award 2013, 2014, 2015, and 2016, and 17 and 18 by PVMC and PVMA. Research Productivity Award 2013, 2014, and 2015 by PCST Government of Pakistan. A Best University Teacher Award 2014 by HEC Islamabad. Distinguished Leadership Award International 2015 by University of Minnesota, USA. I'm audible?
Yes.
Yes, we can listen you. Yes. Please, sir.
Dr. Muhammad
Professor
Yunus.
Doctor. Yes. Please, sir, speak. It's your turn, sir.
Hello, Assalamu
Yes,
alaikum.
yes.
Good evening to everyone. First of all, I am very grateful and thankful to Dr. Ajaz Rashid and his colleagues to inviting me for in this international event and conference. Secondly, I want to congratulate Dr. Ajaz Rashid and his team for arranging such a wonderful event for the students, for the stakeholders, and for the veterinarians on the evidence-based medicine, which is a burning issue, and for the awareness and guidance of veterinarian all over the world. I am very optimistic and hopeful that the participants of this international conference which is being held on evidence-based medicine in veterinary practice. Definitely, participants will learn something, skills, knowledge, and techniques and data advancements, which will be utilized in the evidence-based medicine or in the veterinary medicine for the betterment and for the promotion or for the scientific improvement of veterinary medicine all over the world. I am also very grateful students of Crescent from Narwal campus and students from Rifa International University, I mean Rifa campus Lahore, which is a private sector campus, have been involved in this very great international conference, so that students definitely will learn techniques, knowledge, wisdom, and advancement in evidence-based medicine, and will serve the nation, country, and profession with a better way. In this way, we will be able to train the manpower in Pakistan also, which will play a key role for the improvement of knowledge and techniques and skills. The main thing is that the students and stakeholders, the things which they learn from this international conference should be utilized for the promotion of their respective departments and for training of the manpower in the country. Actually, the implementation is the issue. They should be implemented in their knowledge, in their practice, in their profession, in their respective departments and institutes, so that we may be able to train the manpower more and more, which ultimately result in the uplift of the economy of the country and the skillful knowledge for the students. Thank you very much once again for inviting me in this international event. I'm again congratulate to Dr. Ajaz Rashid and his colleagues and his team for arranging such a wonderful event. Thank you very much.
Thank you very much, sir. Thank you. Where's Sarisma? If you are listening me, please come on and continue this session, please. Dr. Mara? Dr. Mara Khan? Okay, sir. I think so. Yes, please. Dr. Mara, please speak.
Assalamu alaikum.
Yes, we can listen to you. Please speak up. Let me continue this conference. We are getting late. Yes. From here, we have a special welcome message from Professor Dr. Neela Zamir Durrani for this Evidence-Based International Conference 2024. Professor Dr. Neela Zamir Durrani is a distinguished academic leader and veterinary medicine expert, a tenured professor and Dean of Faculty of Veterinary Sciences. She oversees the Office of the Dean 24/7 Extension Services and Student Affairs while monitoring student as the principal officer. Professor Dr. Anila Durrani has supervised over 70 MPhil students and 19 PhD scholars and has published 140 research papers in impact factor journals. She is also the patron of 4 student clubs and principal investigators of the Civic Engagement Program at the University of Veterinary and Animal Sciences, US, Lahore, demonstrating her commitment to education, research, and community services. Please, ma'am, we welcome you for your welcome message.
Assalamu alaikum. Thank you so much for my nice introduction.
Thank you
And
very much.
this is a memorable event for all of us because I have seen our senior faculty members, our teachers, Professor Dr. Akram Munir, Professor Dr. Ashraf here, and also I have, while going through the participants, I have seen Dr. Khalid Shauk. So it is a very nice gathering in which we can put forward our recommendations as well. So the current session of stem cell therapy is also very much a need of the time. And I am really very thankful to Professor Dr. Ijaz Rashid for initiating the evidence-based medicine sessions. And this is the second international conference that he has organized. And we are very thankful and appreciate his efforts because Dr. Rashid has given us a chance to study evidence-based medicine here in our university. And we are now familiar because of the awareness provided by Dr. Ijaz Rashid that through adopting the evidence-based medicine, we can actually enhance the patient care. And one thing that I have missed in our sessions is that in addition to the clinical expertise, we also need to focus as a follow-up of these events. We need to focus on the best possible research as well as on the patient values and the client perspective as well. Although Dr. Ijaz Rashid has always given a very comprehensive discussion on the cases, on the steps and the clinical expertise, but the missing part from our side is research. I also admit that there are challenges because the clinical research is not much reported in journals, and we being in Pakistan, we also need a lot of funding in the clinical research and especially the evidence-based medicine. So since the evidence-based medicine is the integration of research along with the clinical expertise and as well as the client needs, so it is also a challenge for us that we need to integrate evidence-based medicine in our curriculum as well. Based on these discussions and based on the experience that we have gained from Professor Dr. Ijaz Rashid, we are now heading toward revision of our curriculum in the lines of case-based lectures. So there will be a total change in the way that faculty is teaching their DVM students now. And we are also trying to develop our local-based, Pakistani-based CP modules. And in the near future, we are going to organize trainings on that. And for that purpose also, I would request Dr. Ijaz Rashid to patronize us. And the recommendations that we can give through these sessions is that we need to strengthen our curriculum and our research as well. We need to develop evidence-based medicine similarly as it is done in the humans, and keeping in line, we also need to develop evidence-based veterinary medicine guidelines. So that is my learning from the previous sessions with Dr. Ijaz Rashid, and I am very much hopeful that this session will also be going to be a great learning for all of us. Once again, I welcome and on behalf of Veterinary University, I welcome Dr. Ijaz Rashid, and I'm looking forward for a very learning experience. Thank you so much.
Thank you very much, ma'am. I'm very thankful to you for this message. So we are going to enter in our next session. So I now invite our head of the conference, Dr. Ijaz Rashid Saab, Chief Secretary General of MIGU and the CEO of East Windsor Animal Hospital, New Jersey, USA, the main president and special speaker of the conference. Please, sir, we welcome you. It's all about you and your efforts. Thank you very much, sir, to give us such a great conference on evidence-based medicine. Please, sir, it's up to you now. Thank you, sir.
Auzu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Assalamu alaikum to everyone, especially my respectful, very honorable Professor Dr. Yunus Rana Saab, VC US, Professor Madam Anila Durrani, Professor Akram Munir, Professor Dr. Ashraf, Dr. Khalid Shaw, and all other my respectable teachers, professors, students, and everyone who are joining this conference all over the world, please accept my regard. I know there's a problem going on in Pakistan with the internet. I'm sorry for that. I hope you can listen my voice very good. And if anyone has a problem, please let me know. Okay. So I have my very respectful, my uncle, Professor Dr. Akram Munir, so also here, very senior professor, and I really love to have in this conference, and everyone is very respectful for me. I hope you have wonderful time to listen my this conference, and at the end of this conference, I'm sure you will have some idea that how we work in USA and how we diagnose the disease with the latest technology. That's my main objective. The outline of this lecture is that I just want to give a very brief history of the evidence-based medicine, just like 1 or 2 minutes. I don't want to waste the time. My real focus is the case study, to present the real case which we see in my hospital in East Windsor, and how we do deal with that cases and how we solve the problem. So students and the practitioner and the teacher, they can understand how we work in USA. That's my main objective. What is the evidence-based medicine? As I discussed with you guys before also, the evidence-based medicine basically is when you have evidence about any disease, when you're treating with the patient, then you have more confidence to treat the patient with the knowledge, with the experience, and with the proper treatment. But if you don't have evidence about any disease and you're treating the patient with guessing, I believe the chances that you are not doing very well, on patient may be on danger side, patient maybe die with your misguidance, with your malpractice. So the more objective this evidence-based medicine is that if you have evidence, you can treat the patient very confident. That's the punchline of the evidence-based medicine. There's a long history of the evidence-based medicine. Evidence-based medicine starting in 1860 in human. I think Dr. Cloyd is starting 1816, and then veterinary evidence-based medicine starting 1960. But until 1980, they are not very common. Then 1990 and 2000, Dr. David, Dr. John, they're starting on the evidence-based medicine. They focus on this one. This is very important in veterinary medicine also. Then 2004, there's the group made in USA, Veterinary Evidence-Based Medicine Association was made. And 2007, the AVNA, American Veterinary Medical Association, they make the committee to make veterinary evidence-based medicine on to recognize this one. And 2010, a lot of universities, they adopt evidence-based medicine in veterinary field. And 2015, the first time AVNA published a guideline for the practitioner that this is the guideline to practice in USA. Please, if you don't follow this guideline, your license may be in trouble or you may be facing problem. This is a proper guideline. I just give you one example. This is the patient is coming out of hospital with eye problem. And when we check the physical exam and we did the fluorescent stain, and we see the patient have like a cornea ulcer right there in the when the stain is highlighted. You can see by here with the white, the fluorescence here where my marker going on. So after this diagnosis, when the patient has the coronary ulcer, if some practitioner give the wrong medicine, just like a dexamethasone, the patient eye maybe go worse. And if he go worse, and if he challenge this case, the practitioner does not have to defend this case because the AVMA gave a proper line, proper guideline that if you diagnose the coronary ulcer, do not use the steroid medicine in the eye. That maybe go worse. You have to use this medicine. That's for the best for the patient. So these are the AVMA guideline how to treat the patient also. So let me start with a case study which we see in our hospital. We see this case in 2017. Is very interesting case, and I just want to share with you. This cat is 8-year-old male domestic short-haired cat. Is presented in our hospital. The only one reason the owner noticed the gaining weight. We diagnose this patient is also on insulin. They have diabetes, but the owner has a concern. Why my pet is gaining weight? Look at the concern. Eating, drinking, everything's fine. Everything's okay. But the only concern is that why my pet gaining weight? That's his mind. He was very upset. What's going on? Because when the patient is diabetes, it should maybe lose the weight, but is losing weight, is gaining weight, is going the opposite way. Okay. So look at the owner concerned also. The owner is also very well educated in USA. And I'm hoping in same thing happen in the Pakistan also due to the online internet media, internet material, everything. Before they coming in the hospital, the owner read everything online also with a Google doctor also. So be careful. You have to well knowledge. You have everything, your fresh knowledge and everything up to date if you want to beat right now in this veterinary field medicine. So this is like let me show you how the history. How about the eating and drinking?
Eating and drinking is fine. Everything is good. He's happy. The tail's wagging. He's purring. He's happy. Just think of the weight.
Okay, there's only one sign you see, gaining of weight.
Correct.
There's anything wrong.
Nothing else is wrong.
Okay. So how long you see is gaining like a weight like it?
Every week he puts on weight.
Okay. So maybe like a week or 10 days, you see the belly going bigger.
5 to 6 to 7 days, he'll put on weight.
Okay. Okay. That's it. Okay. So when we check the physical exam, everything look okay, everything is normal. Most of the time, my vet student and vet technician, they go in the exam room, they take all the history and everything. And after that, I discuss with my students, with my vet tech also, what's going on, what do you think about this case? And we just make the plan like what we want to do. I have everything on my brain, my mind, whatever I want to do. I narrow like a diagnostic, then we do like a proper test. We don't want to do like 100 tests, then we diagnose the disease. That's we call the malpractice. We want to go on the target area where the concerned owner has and what we want to do. This is the called quality of medicine. It's not like if we're making the medicine for the test. It's not a testing, it's the quality of medicine also. So after listening all the history and everything, what is the possible cause? I discussed with my students and my tech also. The possible cause in this case may be heart disease. Maybe they have a tumor. Maybe have parasite worm. Maybe have FIP. Maybe have organ failure. These are the major line we figure out. And how we want to diagnose this disease, what's going on with this kitty. That our next step is that I tell the owner that we want to go ahead and take x-ray to see what's going on. That's my first thing, to see the x-ray, what's going on in this kitty. When we took the x-ray and we see like here the x-ray, you can see a lot of fluids in the belly. You cannot see the organ properly. You cannot see like anything in this case because there's a lot of fluids in the body. But if you look at the history, the owner said that everything's fine. Everything's okay. Eating, drinking, everything's fine. Only problem is that the gaining weight. There's only concern going on. But rest, everything's fine. But this is the normal look at the cat. You see all the look, the liver, stomach, fat, small intestine, GI tract, kidney, urine, bladder. But if you look by here, you cannot see any organ very well because there's a lot of fluid. Due to that one, you cannot see the abdominal cavity very well. Then when we took the X-ray, I discussed with the X-ray, and then I tell the owner, my next step is that I'm gonna drain the fluid from the abdominal belly to see what's going on, what color fluid is coming on. And we want to check the blood work, and we want to see what's going on with the blood work. Maybe have FIP, maybe have something else, maybe organ failure, maybe something else. That's our next step. So when we move the next step, we drain the fluid from the and when we drain the fluid, we see like a white milky color fluid is coming from the cat. And we definitely know that this is not FIP. FIP color is totally different, little bit. But this milky color fluid is coming, then definitely we know there's something going on, maybe organ failure. That's why the fluid is coming, okay. Or maybe they have some tumor. That's our possible cause. So we send this fluid to the lab, whatever we receive, and the lab result is coming back here. We still did not find what is the exact reason why this what is going on. We did not see still, if you look the comments from the pathologist report and everything, we still did not know. We checked the blood work and we see the blood work, flying leukemia is negative, FCV, coronavirus, everything negative, toxoplasma is negative. Everything look okay. We don't see like any other problem, anything. Only we see neutrophil is very high due to the inflammatory cell. Pancreas is a little bit high, but the cat is still eating and drinking fine. Then our next step is that we discuss with the owner, we want to go ahead take the ultrasound to see what's going on inside, okay. When we take the ultrasound, we see that some liver has multiple tumor going on, okay. I wish I can show you the something. I think they put my tech making all this slide and everything. This is a liver. You can see that they have a big tumor here, multiple tumor going on the liver. And you can see with the video, I think my ultrasound doctor, Dr. O'Brien, make this video clip. I am not ultrasound specialist. Dr. O'Brien is ultrasound specialist. They will do perform the ultrasound. In USA, everyone had to work in their domain. Because I'm not ultrasound specialist, I'm not doing ultrasound. Someone had the ultrasound specialist, they can do the ultrasound and they can let me know what's going on my patient. So they check like everything and they finally see there's something going on the liver. And this is the report from the doctor also after they sending the X-ray to the board certified radiologist to confirm the diagnosis. When we confirm that diagnosis, we give the option to the owner because there's a multiple tumor. If they have only one tumor on one lobe, we can remove that liver, that lobe, and the patient will be okay for give like a little bit more quality of life, and we increase the lifespan. But the owner decline chemotherapy, owner decline everything. They just want to make him comfortable, and we make a plan that okay, whatever is okay with you, we can go some alternate medicine. And we give like a herbal medicine also. This is like a very good medicine root. It also absorbs the fluid and is also help in the cat. I think the cat live after we diagnose 6 months, around 6.5 months. Okay, we also put like a liver supplement to support the liver, and the rest we drain like a fluid every 2 weeks. So this is the how we starting from the owner has concern like only gaining weight at the end where what we find. This is we call quality of medicine. We know what we are treating. The owner is also satisfied that what we are dealing. He knows that what's going on with my patient and how much life my pet has. All this is due to the evidence-based medicine. Our next is very interesting case. I just giving the example that I see listening a lot of story in Pakistan also that somebody misdiagnosed, somebody did this thing, this thing. This thing also happened in USA. We see a lot of cases. When I see some cases coming from the other hospital, they misguide, they misdiagnose something like, then the time you will become like a within professional limit. I don't go any backbiting anything. No, my job is to diagnose properly and give the proper advice to the owner. My job is not that to tell the owner that what the other vet do anything wrong or mistake. No, that's not totally not my job. And the AVM has a clear line. We cannot do this thing. We cannot disgrace or any disrespect to any other vet diagnose whatever he did. That's the matter between the owner and the vet, whatever they have. This is the case, a very interesting case. This is like a 13-year-old female spade. She was sick, was 2 months. She was sick for 2 months, on and off. They have diarrhea. Last 4 days, the patient is suffering very badly, not eating very well, not doing very well. The owner is very upset. One of my clients, that was her friend also. She told this owner, why not you go to the East Windsor Animal Hospital, my vet? Maybe they can help you because this patient is suffering from 2 months and still is not feeling very well. If you look the history of this case. Okay, let's talk about okay. How long you were sick?
I'd say since like the first of the year,
Like you
since
almost
like December, like January 1st.
almost like a 2 month, is it? On and off.
On and off, yeah, like she would seem to get better and then it would get worse. Like she'd have a few days good and then she'd start throwing up again or have diarrhea again. And then she would be like lethargic. It's been pretty bad like she won't eat at all this past week. She got really sick, like threw up 7 times on last Friday, so a week ago.
So when I see the patient, when I ask the patient on the history that what color the stool is coming, she told me that the yellow color. Then I pick up my mind that there's something wrong with the liver. Maybe there's something going on. The most common disease in my brain at that time, because have diarrhea, vomiting, all these symptom sign is very close to with the leptospirosis. And I tell the owner, I like to do only one test, leptospirosis. Let's see if this test is positive or negative. The owner said, that's okay, that's fine. Go ahead, do the test, okay. When we do the test, okay, and if you look my next slide, is coming with the positive with the lepto, very strong positive with the lepto. When I find the disease is positive with the lepto, when I show the owner the result, believe me, the owner was crying in the room. She said, my pet is suffering 2 months and no one find what is going on this patient. And we start giving the doxycycline, we start giving the antibiotic injection, we start giving like an antibiotic injection also in the beginning until patients start eating food very well. And after the 3rd and 4th day, when the patient feeling much better, we start in the oral medicine also. But meanwhile, 3 days, we give like a polyflex injection, and plus we give the serenia injection and other anti-nausea injection also. Hopefully the patient start feeling better, and after a couple of maybe week or 10 days, believe me, the patient is feeling better, no more diarrhea, and no more vomiting, everything look fine. Why this happened? Due to the proper diagnose. If I don't diagnose this patient properly, what is going on with this patient. At the end, he will die with the leptospirosis. And leptospirosis is a zoonotic problem. When you diagnose disease, we have to be very careful. We have to put the glove. We have to go for the diagnostic on my, if we touch like urine or anything, blood sample, anything, then definitely I will tell my staff, please go ahead, go for a screening test also, because the leptospirosis can be very dangerous to human being. So we have very careful. We have to treat this patient very careful. The prevention is always better. We always recommend in my hospital, this vaccination, leptospirosis vaccine is very important. We give the advice to the owner. If the owner does not want this vaccine, they have to write down that we are taking the risk. We don't want this vaccination. We keep that record in our hand, because just in case when something happen, the owner always blame on the doctor. So keep your bag safe, and always play like a safe. Do not play like if you say, oh no, I don't want to do the vaccine, and just no, you have everything written proof, so you can show the owner, I gave you the advice, but you did not follow my advice. That's not my responsible right now. I am not responsible for this thing. So my next slide, I just want to show that how we treat this leptospirosis. This is my hospital website, like a note and everything, how we give the treatment, everything. I just want to go move further because we have very short time. This is another very interesting case. Maggie is also a 9-year-old female spirit. Is this very interesting story? They go. This is not my patient. This is not my client. This is not my patient. They go to your regular vet. By the complaining is that the patient is not feeling very well, feeling pain, going like this and this, not sleeping in the nighttime, and also did not sleep like a properly, lethargic, did not. When the owner sees the patient is not sleeping nighttime, he's just like wandering here and there, here, nothing. They go to the vet, regular vet. The regular vet checking everything. They give the pain medicine, and they say, oh, maybe they have something else. If you did not feel very well, go to the North Star. They maybe have disc problem, maybe have some nerve problem, this thing. They say, okay, after 2 days, the patient still not feeling good. This owner take to the emergency hospital, the North Star emergency hospital. The emergency hospital, they open 24-hour in USA, and they have board certified specialization there. They are emergency vet also there. They also check the patient. They did like some diagnostic test, and after that, they see they have some neurological problem, something like they gave like a pain medicine for the nerve pain medicine, and they discharge the patient. Owner came home after like 2 days. He's still not sleeping nighttime, still not feeling pain. Okay, owner was very upset, very frustrated. He was discussing with one of my clients that my patient, my pet is suffering like almost like a 6th day. Is not feeling very well. He told this Maggie owner, why not you go to the East Windsor Animal Hospital? My vet is very nice. Maybe he can help you. Okay. He said, okay, he make an appointment with our hospital. And when he coming in our hospital, and when we check all the history and everything, when I check the physical exam, believe me, within 2 minutes, I say this dog may be suffering with the Lyme disease. Let me do the test. Let me do this Lyme disease test, tick-borne disease test to see what's going on. And plus, I need to check the blood work also to see what's going on. The owner say, please go ahead, do the test, do whatever you want. So when we do that test, if you look, that test is coming like a positive with the E. canis, the one of the tick-borne disease is same thing, the Lyme disease, but different strain, and is also positive with the anaplasmosis. The both disease is they cause like lameness, limping, severe pain, arthritis. Plus, when we check the blood work, if you look the blood work, if you look all the liver values high, all the liver values high. When I see the glucose is also high, Then I figure out why this patient is not sleeping nighttime. What is going on? Okay, because this patient is suffering with the diabetes, and plus, due to the diabetes, the liver value is also affecting. All this value is affecting to the diabetes due to the blood sugar high. Plus, this dog also had the anaplasmosis. This dog also had the e-canis. All these factors causing a lot of pains. Okay, and when we explain the owner, when we show the result, believe me, this owner is also crying in the room, in the exam room, that, oh my goodness, why they did not diagnose this patient properly? Why my patient suffering for 7 days this disease? Okay. So we start giving the treatment. Let me show the other blood work also, remaining part of the blood work. So here's the, we check the urine test also to see what's going on the urine. Urine is also coming glucose because due to the diabetes. This is the medicine. We start giving the medicine, we start giving the treatment with the insulin and also with the doxycycline, all the proper treatment. First of all, we give the injection to make them comfortable, start eating food very well. And after that, we put on the oral medicine also. These are the soap note, whatever see in my hospital website. The basic component of the treatment is that the doxycycline is a drug of choice in this case. And also the different insulin we're using in the pet. This Prozac is also very good insulin we're using the dog and cat, but I use this one in this case, the human and insulin is a generic form from the human insulin, but it's working very well in the dog. These are the other vaccine also available. It depends upon the practitioner, whatever the insulin they pick up. If that insulin is not working in one pet, then we go for the move the next insulin also. If you look on this is the owner of the Maggie.
This is a story about Maggie. Maggie. They got Penny or whatever, her son, and I got Leonidas over there. Maggie had issues with, she was crying a couple days in fall. And when I went to my regular vet, and she got diagnosed with nodules on her liver, spleen, and she had a urine infection. And she gave me some antibiotics and a painkiller. And she told me if it gets worse, then just bring her to the hospital. So by, I mean, she's crying day and night. And by Tuesday, something like that, Wednesday, I went to North Vet Hospital in Robbinsville. And after 4 or 5 hours, they told me she had a chronic degenerate nervous system, which I found ridiculous. And they gave me painkillers to send me home. And still crying. Then Thursday, my colleague said, why don't you try East Windsor Hospital? He goes, they might help you out. So, I mean, when you don't sleep 24 hours for 10 days, me and her trying to calm her down. I brought her to East Windsor Hospital, and my first impression was, I saw a picture of Dr. Rashid with a lion. So I go, this is the Lion King doctor, so I think he can take care of her. And it only took him like 5 minutes to tell me she's got Lyme disease, the way she walks, and the way she's acting, she's all in pain. So he did a test blood work. He goes, I'll do a full spectrum of the blood work. And he comes back, he goes, definitely Lyme disease, and she's diabetic. That was a shocker to me, that nobody could pick up that. And he said that this is common.
So if you diagnose properly and treat properly, the owner will be very happy and the patient is also very happy. That's the whole objective. My last case is very, very interesting case because I'm a certified vet stem cell therapy, and I also do the stem cell therapy in the pet also. That's the most interesting case I see in my life. This is like a stitch. They are very poor family. They don't have too much money. And my staff, they're raising the money because the stitch has a back problem, the disc problem going on. The stitch need the surgery, but the owner is very poor. They doesn't have the money to afford the surgery. So they try to raise the money, and these are starting my technician online website, and they collect the money also. This is the story of the stitch. You see how he's walking? He's paralyzed with a disc problem, with a lumbar sacral, L5, L6. I can show you like you can see how.
So, you work at double tomorrow, right?
You see how it's
Yeah, is there any time before 10:30 that you could do, or just 10:30? 10:30 is our first. 10:30 is the first.
so the owner has very limited money. So we collect some money also. And believe me, I did this treatment for nothing. We just try to help this client, okay? And we collect the stem cell, we send to the lab in California. They make the stem cell, they send me the next day. Then we inject the stem cell. We give like a 4 injection, and plus we give 1 injection IV to cure everything's okay inside. Did they have any cells or any damage cell happen, okay? And after 12 days aggressive treatment, look the result when it's coming back.
What the heck? Look at you, stand. Crazy.
Okay. Doesn't need any surgery, huh? Okay. Look at what I say. Doesn't need any surgery anymore. This is a stem cell therapy. Is very effective in some cases, not in every cases. Some cases I see a very good result.
Ready?
Doesn't need any surgery right now. It's okay.
No.
Look at the paralyzed from here.
Sit. Hey. He's a miracle dog. Come on. Sit.
He's okay. No, you want to continue the medicine.
What's that?
You want to continue the medicine.
Bernie, like the things that I learned, like I don't know if you like, I just feel like God is greater.
You see, look at the client. They bring like also a flower for my tech also. They gave me the gift also. They are so happy. If you do something good, you will get the reward also from the owner, from the pet also. This is also blessing of Allah subhanahu wa ta'ala when you treat the patient properly. Believe me, due to their blessing, I cannot imagine that God gave me so many blessings. Everything God gave me. I'm thankful to the Allah subhanahu wa ta'ala that Allah gave me everything, do the reward for treating the patient. And my job, sometimes I'm doing my job just with my heart. I'm not doing like a job like, oh, I have to go like a 9 to 5, 9 to 6. This no. Sometimes if the emergency coming in my hospital at the time of the closing time, my tech and I will stay maybe midnight also to help the client. And my tech, they are so amazing and wonderful staff, to be very honest. They try to help the patient no matter what's going on, okay? And at the end, I want to say that if you have any question and answer, we can take your question and answer. Before I take a question and answer, I know in this conference, I have Dr. Khalid Shaukh Saab and also Professor Dr. Akram Manir Saab. Let me take the comment from them. Let me open the mic from the Dr. Professor Akram Manir Saab. Assalamu alaikum, sir. Sir, you are here?
Hello, assalamu alaikum. Can you hear me?
Yes, sir.
Yes, sir, we can.
Yeah, it was really nice presentation by Dr. Ijaz Rashid. I have met him in the USA very recently. He has a very good reputation amongst the pet owners. He has been working there for quite a long time. And the 3 cases presented by him indicate his proficiency in diagnosis and treatment. Thank you, Dr. Saab. I congratulate you.
Thank you, sir.
A few words about the people who are attending this conference. I believe that every student who is getting his DVM or who is already a DVM or even a PhD would always think of going to foreign countries, especially in the USA. But we have to understand there is no guesswork there like we do here. It could be case of SARA, it could be case of constipation, it could be case of colic. This is not the way. You have to be very proficient and you have to have a real good clinical eye in order to uh, satisfy the owner. So if you have that experience and if you have all the tests available, clinical tests, which always help you in diagnosis, you will be a proficient doctor. So I suggest we use the evidence-based medicine, but at the same time, I have also one information to share with you that is on the artificial intelligence use in veterinary medicine. This field is quite open. I think if Dr. Neela was there, she would second me. This field is quite open and needs our practice too, especially in case of radiology and parasitology. We can use these way of treating. Artificial intelligence is emerging as a very good science. I had the discussions with my friend in the University of Connecticut. He is also a professor of microbiology. He told me that this is being already practiced in awarding PhD degrees in veterinary medicine. So again, I want to thank Dr. Ijaz Sheed for giving the Pakistani students a chance to learn from his practice, on-hand practice. One thing I wanted to ask Dr. Ijaz, when we deal with the cases, are somewhere we are not deficient that we are not using the gloves, the mask, and the cap. I am afraid that most of the time these things are not used in Pakistan. Maybe they are taught in the classroom, but I have not seen many of the people using it. Ji, Dr. Ijaz, thank you.
Yes, sir. Thank you very much. Yes, we always use the gloves in exam room. We have the gloves and everything. Our tech, they're using the mask and gloves because you never know what are you dealing. Maybe sometimes the case is coming leptospirosis and it's not a case. Yes, yes, of course. And I'm hoping in Pakistan, they also start using the gloves and mask and everything. And I see some very positive changes. Believe me, in the beginning, when we start my conference, and after that, we see a lot of positive changes in Pakistan, which is, I think, amazing and wonderful. I know the source is very limited, but still they're trying their best according to their limited sources. They are doing very well. I see a lot of students, a lot of practitioners, they send me the case also. They discuss with me case also. They also doing like blood work, X-ray, ultrasound, and these are very, very positive signs. And I'm also requesting all the participants, please write down your name and your university name also, so we can send you the certificate also. Please write down your name, all the participants in the chat room, write down the name and everything, so I can take a copy and give the copy to the Dr. Maraj also. Thank you very much. And I think I need to invite the next one. If that in the conference, I heard that Dr. Carl Shok is also here, I think. Please, can they raise a hand? Is anyone?
Sir, Dr. Mara Pahwal, please make her as a co-host.
Yes, I make the course.
Sure, sir.
So I really appreciate all the participants. They write down the name and the university and where they're practicing. I think that will be great. I appreciate if you can do that. In this way, we have proper.
Sir, here we have Assistant Professor Farooqi Saab. He is the convener and the faculty advisor to the Savers Narwal.
Yeah, sure. Just give
Please
me
make
1 second. 1 second. Just give me 1 second. I just make the host for the Dr. Khalid Shok Saab. Ji, Dr. Khalid Saab, you hear me? Can you unmute your Yes, Maraj, go ahead.
So we
sure,
have
is he the
Professor Dr. Said Sumro from Tandajang University with us, and he
Yes.
has raised his hand.
Yes.
Maybe he wants to ask something.
Yes, sure. Why not? Just give me 1 second. Yes, sir. Go ahead. Dr. Professor Said Saab, go ahead.
Dr. Saab, very nice. Your lecture is very good. Actually, I got the point from here that you should have very much knowledge about the medicine and the clinical medicine. So for the evidence-based medicine, it is important. So really, it is very a good lecture for our newcomers, the vets who want to get the practice in overseas, especially in USA. So it will be very helping. Thank you very much. So nice of you for giving this information.
Thank you, sir. Thank you. Anyone? Maraj, go ahead. The other one.
Thank you, sir. Okay, sir. Please, Hussain Farooqi, sir. Hussain Farooqi, please raise your hand. So we will be able to see you here. Shahzeb, right? It's not him.
1 second.
Assalamu alaikum, everyone.
Yes, Walak.
Yes, sir. Here we can see him, Shahid Hussain Farooqi, sir.
ये जो स्पेशल एनर्जी कॉन्फ्रेंस यो मना न्यू जर्सी में यो डॉक्टर एजाज ना ना पाकिस्तानी डॉक्टर एजाज यूएस में
Go ahead.
Okay, sir. So the session of McGill introduction is gonna, you can say, happen. So let me introduce the McGill. It's a dynamic global organization dedicated to connecting worlds, empowering nations, and serving humanity for a sustainable Earth. At McGill, our mission is to spearhead a global movement towards a more interconnected, empowered, and sustainable future, with a steadfast commitment to fostering global connectivity, empowering nations, and serving humanity for a sustainable Earth. We stand at the forefront of positive change, embracing collaboration, innovation, and inclusivity as our guiding principles. We tackle the diverse challenges confronting humanity with unwavering resolve. From celebrating the rich tapestry of biodiversity and cultural diversity to propelling educational advancement, nurturing leadership excellence, and advocating for peace and harmony. McGill serves as a beacon of hope and progress. We provide a dynamic platform for individuals of all the backgrounds to unleash their potential, fostering a culture of lifelong learning, critical inquiry, and impactful leadership. Grounding in evidence-based decision-making, international cooperation, and a commitment to a sustainable development, we strive to create a world where equity, justice, and sustainability prevail. We have 20 goals as a missionary goals. Even from our 20 goals, our one goal is aligned at only to focus United Nations Sustainable Development Goals. Those are 17. We have volunteer officers from up to 60 countries in McGill now, and along with our mission to show positive impact upon 170 plus countries for a sustainable earth. You can also serve the nations voluntarily by becoming member of McGill or becoming the part of establishment of McGill. We welcome you on journey for making earth more sustainable from current and future generations. So let me invite Mr. Assistant Professor Hussain Farooqi Saab, please come and introduce the Savers Narwhal. Thank you, sir.
Assalamu alaikum, everyone. It's Dr. Shahid Hussain Farooqi. I'm working as Assistant Professor in Medicine at College of Veterinary and Animal Sciences, Narwhal. With that, I'm also serving as the faculty advisors for Savers, which means Special Animal and Veterinary Emergency Relief Society. I just want to say something about Savers, that it started quite earlier in the main campus, Lahore, and the late Dr. Qaid was leading it. And the main motive of this society is to train the farmers, to educate them, to listen to their problems, and then we provide some technical support to these farmers in the form of like field days, farm meetings, free camps. Beside these, we used to arrange various lectures, which can be technical or something sociological about the social issues. Besides, we arrange some seminars and webinars for the DVM students and veterinarians, the veterinary officers working in our circles, to train them about some burning issues of the time. These are our routine activities. Now, I'm very much thankful to Dr. Ijaz Rashid Saab, who given us his precious time. And I will appreciate Mr. Kabir, who is the third president of Narwhal chapter Savers. He worked a lot. He is a very busy person, a very dynamic person. He used to contact various mentors and scientists and clinicians around the world to address the students about the current and the very updated knowledge and the information that need to be shared with the students and veterinarians around the country. I'm thankful to Dr. Miraj. He was in quite a continuous and regular contact with Dr. Kabir. I wasn't in direct contact with you guys, but as Kabir was already working on it, that's why I was at the background. Thank you so much. It was really informative. The evidence-based medicine, as we discussed issues with the farmers, no doubt we have some challenges in terms of diagnostic tools in our country, but whatever we have, if we can use them wisely and correctly, we can have some significant evidence based on which we can diagnose and treat our cases. But unfortunately, as Dr. Ijaz said, we can't say if some veterinarian is doing it wrong. Everyone has his own basis for the diagnosis of that case. But if we can review our knowledge, if we can review the things, we can update our knowledge, we can have better evidence, and we can have a better diagnosis, and that will ultimately help the farmer, help the suffering animal. So this was really amazing. I must appreciate each and every person involved in this noble, I would say it is a noble event where you are disseminating a very informative things and stuffs with the veterinarians and students around around various institutions in Pakistan. Thank you so much.
Thank you, sir. Thank you very much. Thank you for your nice word.
Thank you very much. Thank you, sir. So, Dr. Jasab, thanks a lot. You always be very kind and giving your time to the youth in Pakistan, specifically related to the veterinary sciences. Thank you very much, sir. Thanks a lot.
Just give me one.
And
Just give me 1 second.
yes, sir. Sure, sir. Sure, sir.
My friend Dr. Adnan Rana, I think is from the Saudi Dubai. He just want to say something. Ji, Dr. Rana sir. Ji, Assalamu alaikum, Dr. Rana sir.
Sir, please unmute yourself. You are co-host now, sir. Dr. Dansa, please unmute yourself, sir.
Ji, Dr. Saab, ji. Go ahead.
Yes, you just unmuted. Again, you muted now. Please unmute yourself again, sir.
Sir.
Sir, again. Just click on the mic.
Dr. Saab, just click
A
on the
small
mic.
icon.
Dr. Saab, we cannot hear you. Just click on the mic. Just click on the mic.
So just do a single click on the screen. A small, you can say a slash will open just at the bottom of the mobile screen. After that, you will be able to see a small icon of mic. Just click on that mic, you will be unmute. Can we unmute him, sir? Sir, Dr. Jasa, can we?
I try. I might try myself. We send the request also. Okay. We have anyone have the question? I think that I see in the chat room there's one person they asking me like if they have a cancer, multiple tumor on the liver, what's the treatment option? Okay, the treatment option is a chemotherapy is the best option. But if the owner don't want the chemotherapy, then we use the alternate medicine also. Just keep comfortable to the patient. Anyone has any question, anything, please, or they want to discuss anything, they can raise their hand and I can unmute their anyone. If they have any question, any concern, please raise their hand.
Yes, guys, please ask the questions. This is question answer session. Just you can, if you are unable to unmute yourself, you can say leave a text in the chat as a question. Yes, Izhan, please speak up. Dr. Adnan Nana, please sir. Adnan साहब आगे दोबारा सर. देखिए जरा होते हैं बात करना चाह रहे थे कोई सर.
Yeah,
Assalamualaikum.
Yes.
First of all, I'm very thankful to Dr. Ijaz for being here with us and giving us such an informative presentation on evidence-based medicine. I just had a query, sir, because in Pakistan, there is a financial constraint on the part of the client, and they do not want to get the test done. And I am assuming that there are many clients that you have faced in your lifetime there in abroad that fall in the same category. They do not have the financial liberty to get the test done or to move on with the treatment. So in that case, what is your protocol to go with the diagnosis, or you just leave it at symptomatic treatment?
So first of all, let me tell you one thing, everyone who's participated in this conference, the practitioner knowledge, experience is more efficient than the diagnostic. If you have experience, if you see the cases very well before, you know what's going on this patient. Without any test, without any diagnostic, you know 100% you're diagnosed. Before I go to the exam room, to be very honest, I know what's going on this patient because this all happen with the knowledge and experience. If you don't have a knowledge and experience, no matter whatever you do, they are still maybe doing something wrong. But if you have very good experience without any diagnostic test, you can do the treatment properly. But if you have a diagnostic, then you have a confidence that you are treating with confidence. That's the call evidence-based medicine. That's the punchline of the evidence-based medicine. If you have it diagnosed, then you show the owner, this is the treatment I'm doing, this is the patient suffering, then you have full confidence. That's, to be very honest, that's the most, I can say in the evidence-based medicine, that's the most punchline. When you see the confidence, you build the confidence in your own also, that you are satisfied that what you are treating. But if you don't have any available resources or something like, still your experience is very good. Your knowledge, I see in Pakistan, large animal vet, they are so expert, they are so experienced. By looking the patient, they know what's going on. Without doing any diagnostic test, they know what's going on, okay? And they're treating, most of the time, they're treating 100% accurately. So the practitioner knowledge, experience matter. Diagnostic, yes, of course, is matter. With the latest technology, we have to do all the latest technology. The world is changing right now. Before, I'm telling you, I see the one of the group discussion going on. They say the cow, buffalo, before price is like 1 lakh, 150. Right now is almost like 8, 9 lakh. So the people, they don't want to waste the money in unexperienced person hand. They don't want their precious vet, they don't want the precious animal to give in the hand of the unexperienced person. They can do. Sometime I see the story also. The patient is suffering like a dystocia. The patient suffering with the LDA, and patients has something abomasal displacement, and they doesn't know the proper treatment, and after a couple of days, the patient animal died. So your experience is better in this case also. Ji Rana Saab, Dr. Adnan Rana Saab.
Look, can you hear me now?
Yes, yes.
Yes, yes.
Luckily, finally and luckily. Because I was on travel from Muscat to Dubai. So it was on and off going with the signals and other stuff. But very nicely done, sir. Thank you so much for your time, for all your inputs and each and everything. All the 4 cases, the liver cancerous one and the leptospirosis, anaplasma, and the other one. The 4th one was pretty interesting for me, especially the stem cell therapy. It looks quite fancy. And nowadays, in Dubai, multiple clinics are trying to do it, and they are charging heavily as well. So please enlighten us more about that one. Number one, a few of the participants also put some questions in the comments. What type of stem cells are being used, and how long is the therapy, and how effective it is. One thing was clear, you said it's not effective for each and every case, but yes, for a few cases it works wonders. Second thing, I got a pick point from great Professor Akram Munir Saab. He said that in Pakistan, it's like, not like that kind of professional stuff for handling the diagnostics and other stuff. So I was wondering, like in Dubai, we have multiple CPDs from different, companies of diagnostics, company of like pet food, another one. So they are keep updating the knowledge. keep updating the practices, keep updating the latest trends. So something like this isn't happening in Pakistan, number one. If not, how can we start it out with your expertise, kind of connections you have, institution involves, you are already well familiar with UAS, all the campuses, Rana Saab, Yunus Saab, the great fellow, and then other institutions as well. So why not to kick off something CPD type of thing? So at least it's time to time kind of upgradation of our practicing vets. That's the small inputs which I just go through, like, when I was listening your whole conversation. Please hand over to you, sir.
Thank you, Dr. Adnan Rana Saab. Thank you very much. And yes, of course, I agree with you. It's very expensive. Stem cell therapy, not everyone can afford in USA also. It's really expensive because, first of all, very first day, we have also, first of all, the stem cell is not for everyone. Somebody say that they can use cancer or something like, no. For the stem cell, the first thing that we give a written evidence to the stem cell lab that this patient is cancer free. Because sometimes if you inject the stem cell, it may be go the other side. It may be create the wrong cells in the body. So we have give a certificate to the lab that this patient, I check this patient is a cancer free. It doesn't have a cancer. Okay, number one. Number two, very first day, we just like make like a small incision in the abdominal, like umbilical by here, a small incision, like maybe 2 or 3 inch, and we take the falciform ligament. The falciform, there's a fat there, a lot of fat there. We collect that fat. That's adipose tissue. It's wonderful tissue there. An animal does not feel anything. There's extra fat. We collect that fat. There's a special bottle, tube. The stem cell lab, they send us the box also. There's a special box. We pack the material, fat, everything. We send them overnight shifting. They receive their next day. They make the stem cell. They shift us back like overnight next day. We already had the plan with the owner, with the timing also that we need to inject the cell on that day. We mostly send the stem cell on Monday because Tuesday they receive and Wednesday we can give the inject to the patient. We cannot set the cell on weekend because this is a long procedure and the stem cell may be died. So as soon as we see the stem cell, we inject. Suppose the dog has arthritis. We inject like a 4 injection at different point, 2 on the hip, 2 in the maybe a stifle joint where I have the most pains coming, maybe front leg has the pain, we get on that joint. And 1 injection, we give like an IV injection. The IV injection repair all the cell inside also. Suppose the liver has a little bit of problem, kidney has a little bit of problem, they can repair the cell. The spinal cord has some problem, the spinal cord, the cell may be repaired due to the IV injection. And after a couple of days, we give the rest. If the patient has like a, suppose they have like a severe spinal problem going on, just like I see the patient, like they have spinal cord, the spinal disc problem going on. So what I did, we ultrasound guided, we inject the same spot with the disc is bulging. We inject the stem cell, plus I inject the dapomedrol injection also, is a long-acting steroid injection to get the inflammation down from that spinal cord. When the inflammation go down, the bulging disc will be coming back to his own position. Suppose the disc is like this way, it's coming back to again on their position. So when the disc is coming on back on position, the nerve, whatever the nerve is pinching on this area, they're not pinching anymore. They're not feeling any pain. The animals feel like a pain-free. Same thing is idea in human being also. So that's also very good treatment, but the lab charged from me $2,465. So definitely I charge more money from the client, plus I charge the money for the sedation, anesthesia on the first day, collection also, $800 to $900. That's the fees that we collect. Plus we charge also like at least $4,500 from the client for the stem cell. Then For the injection, we also charge again, like at least like $900 to $1,500. It depends upon the practitioner also. So it cost is coming like a really very expensive also. Not every patient they can afford. So the stem cell is not for everyone. I know it's very good treatment. Sometimes I give the treatment. The dog is so much painful with arthritis. They cannot jump. But after injecting the stem cell therapy, the owner called me back after like a 3 week, Dr. Sheath, my pet is doing like a puppy. He become like again like a puppy. He running, jumping. He go in the car without any hesitation. So they all feel much better. Okay, but this treatment is not for, I say, for not for every patient because it's selective treatment. We get the selective patient. Patient has a cancer-free. Patient has like a not other any problem. We proper diagnose. We take consent from the owner, and all these things not happen overnight. It take like also education to the owner that how the stem cell therapy happen. What is our result? We can show the result also. Then they will be agree. Anyone has any other question? Let me open this one, Muhammad. Yes, Muhammad, I unmute them. Muhammad Tallah. Muhammad Tallah, can you unmute your mic?
Sir. Sir, I have a question. Is there any condition under which the stem cell therapy is ineffective?
Okay, yes, of course. Sometime is not getting a result like 100%. Okay, but we tell the owner clearly. But sometimes you can get the result only 35%, 45%, 60%, 75%, sometimes 100%. It depends upon the animal to animal, how they respond with the stem cell therapy. But most of the time, I see this treatment is not totally ineffective. It gives some benefit. So it's not like a totally 0%, no. It gives the benefit also. Maybe later on or maybe right way. I see some most of the time. So is suppose sometime I see like right now University Penn, UPenn, they also starting with the kidney. When the kidney is like a damage with a chronic kidney failure, they also using the stem cell therapy to repair the kidney. And right now we transplant the kidney also. In USA, the vet is doing a lot of things. They're starting the transplant of the heart also. They also transplant the liver. They also do the shunt. They also do the pacemaker. They're doing the cardiologist, doctor, they have to perform their job. The nephrologist, they're doing their job. The internal medicine, they're doing their job. Everybody in their domain, they're doing their job. It's not that everyone they have specialized in one field, okay. Just like ultrasound doctor is doing only ultrasound. They're not doing anything else. A radiologist, they're doing only read the X-ray, not doing anything else. But still, they make a lot of money because due to the roadmap the AVM may give them. Dr. Khalid must, sorry, make you co-host. Can you unmute your, Dr. Shoksa, can you unmute your, is anyone has any question, any concern before we close the conference? Let me. You can unmute.
Afternoon, sir.
Yes.
Sir, I have a question regarding the eye problem. Sir, what is the medical treatment protocol for the deep corneal ulcers in which even the basement membrane protrude out? So, what is the course for this case?
It depends upon sometime we use also same thing like a serum, like a PRP serum. We draw the blood from the same. And sometimes we make if you don't have the PRP machine, suppose we draw the blood, we spin the blood very well, we separate the plasma, and plasma, that serum we can use in the eye also. It also give help healing the ulcer, deep ulcer very well. But first of all, you can try the medicine also. Right now, there's a lot of medicine available. There's a very good NSAID medicine available. Plus, there's also Oflexin drop is very effective also. It depends upon the practitioner, whatever the protocol he want to use. Sometimes we also use, it depends upon the ulcer, like how the ulcer look like. Okay, if the ulcer is not healing up or is going something very bad, then we can refer to the ophthalmologist also. The ophthalmologist, the doctors who are specialized in eye in USA, they can take care very well. Their job, because my job is basic to see how they look like, everything, to give the proper treatment. If it's still not feeling good, we can refer to the ophthalmologist also. I don't think so Pakistan has available this facility. I'm right. Pakistan doesn't have a concept with the ophthalmologist also. So I don't think so Pakistan has a way. You can use I say that you can use a serum also. It's very good option. I see very good result. Okay. You can draw the serum, spin the blood very well, make a serum, and put in very sterile container. So give the dropper to the owner, just put the one drop in the morning, one drop in the evening with other medicine also, with the gap at least the gap 1 hour with the serum. And you can see a very good result. I see a very good result with the deep ulcer also. Anyone has any other question? I think that that's enough. And if anyone want to say anything, please, you are most welcome. Just raise your hand. Just 5 minutes more, then we want to go ahead and close the conference. No more. So just give me 1 second. Okay, go ahead. Yes, Saeed, I unmute your, please, can you unmute your? Just unmute your mic, okay? Numan, say, just unmute your mic, okay? Yeah, go ahead. Yes, please go ahead. I don't know what's going on with the internet. Hello? No, your mic is not good. Let's go anybody else, okay? Anyone else? please write down your name and also like where you, which university you belong, or if you have private practice, please write down your place also. So we can, I always check the chat room also, so I can see like, if someone has anything like it, they can,
Assalamualaikum, sir. Sir, I want to ask a question regarding the US licensing.
yes.
Sir, as we cleared the Navali, a lot of questions, a lot of participants cleared this exam. So when we applied for the jobs, they asked that you must be registered with some state, so state board. After that, we will give you job offers. So kindly, can you please guide us regarding that?
I don't think so, because state registration is that after you getting the license, after you pass the, you have the Navali license, you have to appear from the state, okay. Which state you pass the Navali exam?
Restrictive lessons, sir, April 2024.
Are you talking about the restricted license? I'm right, limited license, restricted license.
Yes, exactly, sir.
Yeah, a restricted license is in only certain state they allow. In my state, like in New Jersey state, they does not allow. And some state, New York state, yes, they allow. Some state they allow to work under the supervision of the licensed doctor. You cannot practice without under the supervision. Only you can work with under the supervision. And some state, yes, they can allow you. But they have allow you only like a certain time. I think maybe some state 1 year, some state 2 years, not maximum, not more than 2 years. Anyone has any other questions? Anyone has any concern, any question before we close the conference? Dr. Freed Humayun from Abu Dhabi is here. Please, anyone has any concern, anything, so we can go ahead, and please do not forget to write down your name and where you practice in the chat room. If you have any question, concern, if your mic has any problem, please write down in the chat room also. Let me see in the. Anyone has any concern, anything, please let me know. We can close the conference. Someone asked me what is the effective treatment of the FIP in cat in Pakistan. Okay. In USA, there's very effective treatment available for the cat, and there's oral pill and the injection available. And we refer like we're treating like almost like a 4 cat right now, and they're very effective treatment. All of them, they are FIP free. I can show you the slide and everything next presentation about the FIP. Yes, there's a treatment available right now. Before FIP have no treatment, and most of the owner they put down. But right now there's a treatment available, and the treatment is coming from the China, believe me. And it's very effective. FDA also approved in the USA. Okay, someone asked me that which part of the we want to take the stem cell. As I take, you make them seem like umbilical, abdominal, and you see the ligament, the fat there, a lot of extra fat there, and you collect that fat, that's called adipose tissue, and send to the lab. Muhammad Talha. Yes, of course, I belong to Narwal, okay, district. Okay. Yeah, there's FIP injection, whatever you say that is available in the pills and the injection also. Is a Shabazz Ahmed, yes. Next time, inshallah, with the grace of God, I can discuss about the FIP in detail with the case, whatever we see in our hospital also. Somebody said that please make a conference at least once a month. I wish we can do it, but as you know, Dwight, my schedule is also very busy, but I will try my best, okay? I think we want to make like conference on the large animal also, and the poultry, and also wildlife. In 3 subjects, I have my, inshallah, with the grace of God, if God give me help, we have a conference on the large animal, poultry, and the wildlife also. These are the very good subject, I think. Yes, equine also. Yes, yes, yes. Equine is my favorite, but I'm not practicing equine, but I have my friends who's working in equine. Anesthesia. Yes, 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 yes. Yeah, we can make a on that anesthesia also. I get like a brand new machine also, very very amazing machine. Have ventilator also. It's the most advanced machine we get right now. I can show you that detail and picture also. That machine has a multiple function. Believe me, the same machine they're using in the human in the hospital in USA also. Although it's very expensive, but I think I'm glad I get that machine last month. Yes, somebody say organize the conference on veterinary microbiology. That's very good subject. Somebody say the small animal surgery and surgical problem. Is my friend Dr. I think it's from Sindh. Yes, sir. Yes, sir. I got you. I don't know who said who's my XPS. What's the name? Can you write on your name also? Dr. Atal. Dr. Atal from USA? Dr. Atal Saab is my friend. Dr. Atal Saab, can you raise your hand? Dr. Atal Saab, can you raise your hand? Dr. Atal Saab, can you raise your hand? Is the same? I don't know. Maybe one of my friends is a Dr. Atal from Virginia. He's very good doctor, working at Banfield Pet Hospital. He has very good experience and very knowledgeable. I think, I don't know, maybe it's that one or maybe somebody else, but he is very good doctor. I can take him in the conference also next time. So what do you think the next conference will be? Wildlife, large animal, or the poultry production? Poultry. A lot of people, they say wildlife, large animal, large animal, large animal, poultry. Somebody said next will be the wildlife. I work in wildlife also in Bawalpur Zoo in Pakistan. So avian surgery, very interesting. Zoo and wildlife. We got a lot of people that doesn't have the experience in the wildlife look like. And somebody say the small animal incision. Okay. We can see like what conference we want to make like next time. And I'm hoping maybe on wildlife, poultry, or large animal. Let's see. And there's also a lot of people, they give a lot of input, the other subject also. Okay. I got all the information, your input about the next conference. I will check, I will see the most of the people, whatever their recommendation, and we can go further. Anyone has, like my last question, anyone has any other concern or any other topic they want to discuss next time? Somebody said liver function test, poisonous. Okay, I think anyone, Kabir is here, I'm right? Kabir, I unmute your, not this one, this. Kabir, I make you co-host, okay? You want to say some word, last word, and that's it, we can close the conference? Kabir from Narwhal. Kabir, can you unmute your mic?
Assalamu alaikum, sir.
Yes, Kabir, we hear you. Go ahead.
थैंक यू सो मच सर, बड़ा इंफॉर्मेटिव सेशन था। आपने बड़ा ज़्यादा अच्छा लेक्चर डिलीवर किया एविडेंस बेस्ड मेडिसिन के ऊपर। और बस एवर साहवाल आप की तरफ से आपको शुक्रिया अदा करना चाहते हैं। थैंक यू सो मच।
Thank you, Kabir. Thank you. Thank you for everyone. Thank you for everyone who participated in this conference. And let me close this conference. I hope you have wonderful time. Here in US is long weekend. We have off tomorrow also like Labor Day. And I don't know about the Pakistan. I think you guys have wonderful time. And thank you for attending the conference. And if you have still question, concern, please you can text me. You can text in the chat room also. And thank you for coming and thank you for attending the conference. Allah Hafiz, Khuda Hafiz. I'm gonna close the conference. I maybe leave open the chat room for like a 10-15 minutes, then we're gonna close the conference. Thank you. Allah Hafiz.